All right. Thank you for tuning in to this episode of As Seen on Dr. Desiree's. And today I want to talk about tingling, numbness, burning, or even shooting pain that goes down into your arm. Oftentimes people will have neck pain, but it will also give you a zinger or a shooting pain that goes down into the arm or even like into the hand and the fingers. So today I want to tell you a little bit about what I know about these issues. And I think you're going to want to stay tuned because I can promise you it is not coming from your pillow. So we have talked a lot about pillows this week, best positioning, tips if you have a hard bed or a soft bed, or you sleep on your side, if you sleep on your back, if you sleep on your stomach. So I've given you all these tips and we've talked about many different pillows and many different ways to use it. But here's the kicker. If you have neck pain, numbness, tingling, shooting, burning pain that goes into the shoulder or down your arm or perhaps into your hand, certain fingers, these fingers, your last three fingers, let me tell you, a pillow is not going to fix your problem. And you're probably wondering how I know this. Well, after 13 years of experience and listening to patients who have told me about all the pillows they have bought, not one time has that pillow fixed the problem because obviously they're in my chiropractic office. So all those tips about pillows are to help you keep your neck in the right position, to help you prevent further issues, to wake up feeling a little bit more refreshed. But if you have a problem with your neck currently, especially if you have radiating pain, the pillow's not going to cut it. Okay. The pillow doesn't fix what's going on. So today I wanted to share a case study that I think you'll find very interesting about neck pain. So I do have some information here. Let me just check my computer because I want to walk you through this case. Let me pull up my notes here. So this patient came in, she was in her late 40s. She came in and she described her pain as left-sided neck pain. She said it was constant and it was shooting down into her arm to her left bicep, this area here. So she was having pain in the neck and it was shooting down into her arm. She described the pain as, oh my gosh, I can't stand it. The pain would stop her in her tracks. And she rated this pain 7 out of 10 on the pain scale. So that's pretty intense. She also said that this pain stopped her from doing anything. She couldn't pick up anything because the pain was so bad, it almost felt weak into her arm. And it brought her to a screeching halt. That pain is pretty intense. She had this pain for several weeks, it looks like. And let me just go to one more thing here because I want to tell you all the things she tried to get rid of this pain before she came to my office. So I'm just going to pull this up. So when she first came in, she told me she had tried extra strength Tylenol. She had tried like a hot bean bag on her neck. She had tried, a flat pillow, a firm pillow, laying still. Looks like she bought 7 different pillows to try. And laying in bed on her left side was excruciating. She could not do it at all. So that's what brought her into my office. She came here and we did a full exam and we did x-rays. It's always important to x-ray. So I am a big advocate of making sure we know what's going on, especially if you have pain radiating into your arm. That's a big deal. That's actually a more serious issue than just centralized neck pain. And we did find quite a significant amount of degeneration, which just means the bones have worn away. She had a lot of issues. She had years of physical labor. So that makes sense. She denied any trauma to her neck, but at that point, we're looking at a lot of wear and tear because of the type of work she was doing for many, many years. The areas of biggest concern was that lower part of the neck. So she had a lot of degeneration, a lot of bone spurring, and I can go into more detail of that on another podcast, but basically it's the wear and tear on the bone. The bone was not as healthy as it should be, causing a lot of spurring, and it didn't look as healthy as it should. And then what I do is motion x-ray. So when she moved her neck, I had her tip forward and I had her tip back, and we saw the motion as the bones moving in her neck. I wanted to see how those worked in sequence. So what we did find is the lower part of her neck was not moving properly, had a lot of hang up. It was basically stuck in there. And those nerves that come from the brain and go down, they shoot down into that arm. So that is obviously the place where we were working. We did chiropractic work. The adjustments that I do in my office are really gentle, but within just a few weeks, she was feeling a lot better. She wasn't having pain going into the arm. And then, of course, she was still having some neck pain. So what we do at that point is we really work the muscles. We really work the physical therapy, the exercises in my office, and we really start to get that curve in the spine back to its optimal positioning. And as I go to her follow-up, so 2 months into care, let me just pull this up. I want to give you the details here. So we did a re-exam, and this is 2 months. Okay, so we do intensive chiropractic and treatment for 2 months for this particular case. And here's what she had to say after we checked her out after 2 months. So that left-sided neck pain that was pretty constant, 7 out of 10 in pain when she first came in. After 2 months, she reported it was tremendously better. I put that in quotes, tremendously better. She said she has gone 2 weeks without any pain whatsoever. She is still doing her physical job. So she is working and still doing very physical things, and she has absolutely no neck pain whatsoever. She said, I am very happy that I did not have to have surgery for this issue, because of course that's the first thing that goes into a patient's mind, is that they will need surgery. She did not have to have surgery. She said she has absolutely no issues doing her work, no issues picking anything up, and she has not had that screeching pain that put her to a halt at all. She said all the tension that she felt in her shoulders is completely gone. She feels fine, no issues. She has now started actively walking, a walking program, and she has no problems with sleep. So I wonder, these are great results with chiropractic care in just 2 months for something that she thought that she might have to have surgery for. And my favorite thing about this case, and many cases like this, is I wonder what happened to all those pillows that she bought. I wonder where they are now, because she no longer needs to try all these different pillows. She fixed the problem at the neck, no longer has pain going into the arm. We rehabbed everything up. We strengthened it up. She should no longer have issues here as long as she continues down the course of everything that we taught her to rehab this up. So this is a really exciting case. And it goes to show that, yes, a supportive pillow going forward is going to be beneficial, but the pillow didn't fix the issue in the first place. So that's a fun case that I wanted to tell you guys about, from anything from numbness, tingling, burning sensations that go into the arm, also those shooting pains, anything that you would describe as like a zinger or a electric, that's all nerve pain, and your pillow isn't going to fix it. So definitely reach out if you have more questions about that. That is just one example out of many that we have helped with this. So definitely give us a call if you have any questions about those type of issues. We are definitely here to help you discover what's going on with your neck and why you're having these problems in the first place. So that's a fun case study at Desired Health Chiropractic, seen at Dr. Desiree's. So if you haven't already checked out our tips on pillows, please do that. Like and subscribe if you haven't already, because we're going to share more fabulous tips on exercises to help your body work even better. And then we'll go over some more case studies that I have in my office as seen on Dr. Desiree's. I hope this was helpful. Please give us a shout out if you have any questions or would have any advice on what you would like us to cover in the future.